Here are 3 reasons why you should avoid balance exercises if you want to heal your hip arthritis. Now, most exercise programs out there, whether they're given to you by exercise professionals, healthcare professionals, or it's something that you find recommended on the internet, they usually involve some sort of balance exercise so that you can help your hip arthritis. The number one reason that you don't want to do balance exercises, especially if you have hip arthritis, even if you have balance problems and you're a fall risk, if your goal is to fall less, then you need to increase your overall strength. Because think of it this way, I'm going to read it off to you. What good is it to balance better if you can't catch yourself if you stumble? And the thought that comes to mind is if you're standing on one of these balance devices and your goal is just to stay balanced and your feet are going to wobble, your legs are going to shake, and yeah, it's working your muscles and it's working your balance systems, but what most people do when they're moving around is they catch their foot on something. They catch the edge of the rug or the threshold of the door or that gravel outside, the uneven surfaces, or their pet, and they stumble. And you have to stop your stumble. You have to move your feet really quick, use your arms to grab onto something so that you don't take the fall and then end up hurting yourself. In order to do that successfully, you need strength. Think of this picture. I visited San Diego years back, and I went to the beach. And I saw these piles of rocks, very smooth rocks, that were meticulously stacked. I'm talking like 7, 8, 9, 10, a dozen rocks. Big rocks, like rocks that have some significant weight to them, balanced on each other very nicely. And there's a guy out there taking tips, balancing rocks, and he's an expert at rock balancing. This is a thing. You can Google it. It's incredible to see. But all it takes to knock over that stack of rocks is a little shove. And if you practice balancing on that foam pad or the balance or the Bosu ball, whatever it is, that wobble board, you're great at staying up top, just like those rocks are balanced real nice. But if you just take a little shove, you're going to go tumbling down and you don't have the strength or the balance strategies to catch yourself from that loss of balance. That's where strengthening comes in. So all day long, I say you need to go strengthen. You need to be tiring your muscles out. It needs to be the right ones so that you can have the best balance recovery strategies. The second big problem I have with balancing exercises is they don't fix the root muscle imbalance. In fact, they often feed into the problem because when it comes to hip arthritis, what's going on is the ball and socket joint right here is where the arthritis happens, and very often the ball is too forward on the socket and it's been rubbing there for months or years, and that's what's causing the irritation inside the joint, and that's what sets up the hip arthritis. And the reason why the ball is too forward in the socket and not seated in the middle of the socket where it should be is because there's muscles around the hip joint that are pulling it in that direction, and there's an imbalance of muscles. The glutes are usually not strong enough. So because those glutes are weaker in the back and the muscles in the front are by default stronger, they become dominant and it pulls the ball forward on the socket. And if that's how you live, that's how you walk, that's how you balance, that's how you move, that's how you recover your balance, then you have a lot of strength on the front here relatively to the back. And so your balance strategies are just thrown off. So if you're practicing standing on one leg or even on both legs on that Bosu ball, or that wooden wobble board, and you feel your front of the thigh, front of the hip muscles working the most, then you're just training yourself. You're exercising yourself into an imbalance even further. You're feeding into the problem. And what needs to happen instead is get stronger in the back where those weak glute muscles are, because it's going to improve the balance strategies, but it's also going to fix the root problem, which is to bring the ball into the center of the socket so that you're not dealing with increased pressure inside the joint that feeds arthritis. If you have this muscle imbalance, then what's going to tend to happen when you take that trip or stumble is your muscles on the front of your hip and thigh, those hip flexors in the front and the quad muscles in the front that have become dominant, are going to be the muscles that kick in first to react to try to keep your balance as you stumble. And most of the times when you stumble, you start to fall forward. You can fall in different directions, but it's very often that people are walking forward, they trip, and their momentum's carrying them forward. And you need muscles on the back side of your hip to straighten yourself up and regain your balance. But if you don't have good glute strength back here, and you're imbalanced by having stronger muscles in the front, these muscles are going to contract on the front and just continue to pull you forward. This is why you see people that are, elderly, that are in their 70s, 80s, even as early as their 50s and 60s. When they trip, they just plop down like a tree in the forest. Like there is no effort to even help. You may have had this experience where you said, I couldn't even react. It's because you have this imbalance and you didn't even have the muscle strength back here on the backside of your glutes to fight gravity as you descended down to the ground. You didn't have a balancing strategy. It's because you lack strength, not balance. The third reason you should avoid balance exercises is because it doesn't get you off a cane or a walker any faster. And people are going to argue this, I get it, but let me give you why. If you are working on your balance on the wobble board again, on the foam pad, whatever it is, and you're using a cane or a walker to get around because you don't have great balance, it makes sense at face value. You need the cane, you need the walker, because otherwise you don't get around very well. You tend to lose your balance. Really, it's you have that imbalance, you're weak, all those other reasons I stated before. But if you would like to get off that cane, if you would like to get rid of it, or if you like to improve from using the walker to using a cane and eventually get away from the cane, if you don't want to have to carry around any of those devices, then you need to get stronger in the glutes back here. You need strength. And if you're spending a bunch of time trying to balance on the wobble board, on the Bosu ball, it's not going to fix the imbalance. It's not going to rapidly get you strength back here in the glutes and the butt muscles. And that's what's needed to improve the alignment of the ball and socket joints so you're not irritated in there, so you can tolerate being on your feet without your hip hurting. That's also what's needed for you to have those strategies so that you can trip and catch yourself, because it's going to happen. You're going to stumble. Some things, it happens to everyone. Happened to me last week. I was running and I was tired already, and I clipped the curb and I stumbled. I didn't fall. I took those few stutter steps and then caught myself, and I was okay. And then you have that flush feeling, that scared feeling of the adrenaline that hits you for a moment, and then you go through that. Hey, I want to interrupt the video really quick to tell you about our hip arthritis recovery program. This program has 3 major components in it that you can take advantage of. One is it's got a curriculum. It tells you exactly what to do to heal your hip arthritis, to go from not being able to walk, having pain in the mornings, stiffness in the mornings, fear that you're going to have a hip replacement eventually. It tells you all the steps in the curriculum, but then we've also got coaching. You get group coaching that's live with me and my recovery coaches, plus you get into a community of other people that are on the same journey as you, trying to avoid having a hip replacement and getting back to doing the things that they love to do. Learn more about this program, the Hip Arthritis Recovery Program, in the link below here in the description. Back to the video. If you want to get rid of the cane or the walker, you need to build your strength. Most people, I tell them every time they come into the clinic here, you're just 1,000 reps away from getting rid of that walker, from getting rid of that cane. And what I mean by that is you haven't done the strengthening work, the right strengthening work. Because maybe you've been working on your quads or your hip flexors, but you haven't done the right kind of strengthening work, enough of those reps to get the strength necessary to have the confidence to say, I don't need the cane. Let's get rid of the walker. You just need more strength. And you need to do it in a gradual way that doesn't hurt your hip and that fixes the imbalance. If you can train yourself to strengthen that way, you can succeed, and you don't need to be focusing on balance exercises. Overall, the return on investment for balance exercises is down here. Not saying it's harmful for you, unless you have a really bad imbalance, and it might be. But for most people, they'll say that it helps them overall. They do feel like they can balance better. They feel like they can walk a little bit faster. But if you work on strengthening, because that's what we put people through in our programs. Here in person, we treat them in our clinic. We work on strengthening as soon as we can, as soon as it's right. In our hip arthritis recovery program, we work on strengthening as fast as we can, as fast and as safe as we can get there. We're hitting strengthening exercises, not balance. The return on investment for strengthening is much higher. People consistently feel like they can walk for longer, like their balance is better. We hear stories of people that trip and they stumble, but they catch their balance. It's because of the strength. It's because we're correcting the imbalance. And on top of that, their hip arthritis is improving enough to where they avoid a hip replacement surgery and get back to being active and doing all the things they love to do. So guys, if you're spending your time on balance exercises, reconsider how you're spending that time, and I strongly urge you to go work on strengthening. If you want to get more info about hip arthritis, check out this video right here.